Now, pregnancy journey is one of the hardest tasks for women. Getting pregnant is even becoming a nightmare to many because infertility crisis is without doubt. Now, according to the latest global fertility rate, where it shows, or it has it that the fertility rate is at 3 children per every woman. Let me bring you back closer home, whereby in Kenya, according to the Demographic and Health Survey that was conducted last year, the fertility rate is at 3 women, or 3 children rather, per woman, which is a decline compared to what we saw in 2009. Many women want to have many children or more than that, but there is a problem. Now, are you a woman who is trying to get a child or who is pregnant, but you do not know what to do or even where to go? We have good news for you, because every Wednesday right here on My Doctor Show, we have a very special edition or segment for women trying to get pregnant, and we will be bringing you experts or gynecologists who will be taking us through some of the necessary or preparations, or even if you are pregnant, what are some of the complications that come with pregnancy. And so that is what we will be talking about. You do not want to miss that. If you are a sister, you are a mother, you are a brother, then you have all the reason to watch this particular edition. So today we begin this show by looking at preparations for conception. And maybe you've been trying to conceive, or even you hoping to conceive in the future, then it's very important to have some preparations for your body in terms of detoxing, in terms of diet, in terms of addressing your environment, as well as mental preparations. And so in studio, we will be joined by a very special gynecologist. Her name is Dr. Mutindi Kakuti. She is a consultant gynecologist at Mpisha Hospital. But first, before that, we want to request you to just sit back, relax, and wait for this exciting show ahead. You maybe you want to be part of this show by maybe asking us a few questions or your views. You're always welcome. The number to call in will always be displayed right on your screen. The SMS line is 20268. But before we get into our discussion today, we just want to have a look at a teaser of what we're looking forward to. I earlier on had an interview with Dr. Sikolia Wanyonyi, and he will be just taking us through the introductory part of the preparation for conception. My name is Purity Musel. This is My Doctor Show. All right, welcome back to this special show for women who are trying to conceive. We are talking about preparation for conception. We do apologize for the sound issue that we just had, and so we want to talk about something that we have never discussed, but it's very crucial to talk about. In case you're joining us for the first time, my name is Purity Musel, and this is My Doctor Show. Talk to us. We are talking about preparation for conception. In studio, I have a very special guest. Her name is Dr. Mutindi Kakuti. She is a gynecologist at Mpisha Hospital. Talk to us. The SMS line is 20268, and the number to call will always be displayed right on your screen. You can tweet us at Ebru TV Kenya. The hashtag is My Doctor Show. Welcome to this program, Doc.
Thank you, Purity.
Yes, and it's a pleasure having you. We are talking about something that is very important. Very, very important, but many people don't want to or don't really look forward to having it. First, let's begin with the basics. What is conception?
Well, conception is when you have the female gamete, what we call the ova, what many people call the egg, and the sperm beat together, and that normally occurs at the fallopian tube after intercourse. Yes. So when they join together, they form what is called a zygote, and then that conception has taken place. Yes.
And why is it important to prepare for conception?
It is important to prepare. I think with the medical conditions that we are facing right now, with the change of environment, the lifestyles women are living, the common medical conditions that were not existing before. I mean, rarely did you hear our grandmothers, our grandfathers had hypertension, had diabetes, had thyroid disease, had even cancer, or was even screening for cancer. Issues of weight were not there a long time ago. So now we have to tell women, don't just get pregnant, especially if you have a pre-existing medical condition, is get yourself checked and find out, am I safe to get pregnant? Is it okay for me to go ahead and, you know, conceive and have a baby because of the way times are changing? Yeah, and our diets as well.
Right, and that will lead us to the next question. The people with health complications, who have diabetes, who have issues with their weight, are they eligible to preparing for conception, or there's a special?
Absolutely. Anyone, I mean, we say as long as they are prepared. So, for example, if you have diabetes, if you have a pre-existing medical condition, I have seen, you know, there are certain medical conditions like even hypertension in children, diabetes in children. So when they become adults, these they have to be advised by their doctors when you want to get pregnant. Children who are born with heart conditions, there are even those who have what we call New York Heart Association classification stage 4 heart disease. We even tell them you should never get pregnant because if they get pregnant, the heart condition will worse than the mother's condition, actually puts her life in danger. So we normally tell people who have pre-existing medical conditions, first make sure if it's hypertension, is it controlled? If it is diabetes, is it controlled? There's a condition young girls, we're seeing a lot of young girls now getting called polycystic ovarian disease. Many of them, they are obese. We tell them just lose 10% of the weight you have, and you'll start ovulating, and most likely you'll be able to conceive. Others who have other conditions like thyroid disease, you have to make sure, what is it, hyperthyroidism or hypothyroidism, because the thyroid gland, which sits on the neck, actually controls a lot of metabolism in the body. So you have to make sure that you have to control these conditions. Otherwise, what happens, they get pregnant, many of them have miscarriages, or some of them have babies who have problems later on in life. And
Doc, the umbilical cord research has it that the health of the mother is directly transferred to the baby. So how is it important for a child? Or how is it important when a mother prepares for conception? We are going to look at the steps for preparations, but how is it important for the baby?
It is important because, let me give you an example. If a mother has maybe previously delivered a child who had a heart problem, research has shown that there's a possibility, 20–25% chance that the next pregnancy she may have a child with a heart condition. So she needs to be seen by a cardiologist and then prepared in advance and told, is it even safe for you to get another baby? What's the likelihood of you getting another child who's going to have a heart condition? So the state of the mother's health adversely affects the state of the baby who she's going to have later.
All right, and I can already see some questions coming in, so many questions. How can I get pregnant with twins? How
I love those questions.
Yes, so we are going to really be looking at that. But before then, Doc, maybe you could take us through some of the, or what is the right time for example, in terms of age, in terms of your body size, or even you know what I mean, right? So what is the right time for, you know, this person is eligible? I think now I can begin or think of preparing for conception.
Now, when you discuss health, I realize we have to discuss physical well-being, social well-being, spiritual well-being, emotional well-being. People most of the time think about health just from the physical point of view. So I am healthy, so I can get pregnant. But then there's the social aspect of looking after a child. You know, buying diapers, or even buying napkins, even having clean water to clean the napkins if you can't afford diapers. There's the emotional well-being. If you're a woman who's undergoing emotional, physical abuse, you have you know, we've seen a few patients whereby have been admitted to hospital because their husbands have beaten them up. So you have to look at your entire state of well-being, not just physically, and ask yourself, am I ready to have a baby? And a lot of problems we see is because people are, you know, it's my right to have a child, which it is every woman's right to have a child. But I always say, look at yourself as an entire being, emotionally, physically, spiritually, economically, socially. Are you able to have a child and be able to look after this child? A child is money. Don't look at the baby. You have to think about education up to university. So when we say these days women are, I guess the more educated you are, women know how to prepare. So these days women say, I'm going to get married, or others now, we're getting many patients who say, you know, I want to have a child, but I don't want to be married. But psychologically, they're prepared. Emotionally, economically, they can afford to look after a child by all means. When it comes to age, you know, a lot of research has said, you know, beyond 35, you know, they say the quality of your eggs is deteriorating up to the time you reach menopause. I have seen a 42-year-old woman get her first child. I've seen a 45-year-old woman get her first child and get no more children. But in the past, it has been mentioned that if you have a child later on in life, then there's a possibility of you having complications, diabetes or hypertension, or having a child who has chromosomal abnormalities. So these are the ones we say, if you know you're a high-risk patient, then go and see a doctor and say, you know, I'm 40 and I want to have a baby. I'm settled, I want to have a baby. Then talk to the doctor, and the doctor will tell you, what are you looking forward to? You may actually, majority have a smooth pregnancy. Others, there's a possibility of having complications. If you are overweight, I'm one person who's not afraid of telling a patient, you need to lose weight. You know, there are those who will look at you and say, you know, at our place we are like this, we are big, and you say no. You know, if your BMI is above 30, you're looking at complications in pregnancy. Majority won't. It's interesting, but you don't want to be that 5% who's going to get a complication. Yet you can do something about it before you get pregnant.
All right. I remember we were talking about preparation for conception. Just to remind you, in the next couple of months, every Wednesday on my doctor show, we will be dealing with pregnancy. You know, all the way from conception, delivery, and even after that. So this is the show that you do not want to miss. Remember to talk to us today. We are talking matters preparation for conception. The SMS line is 20268. The number to call in will always be displayed right on your screen. I can see some of your messages already coming in. Trust me, we'll have a whole session of replying or responding to your concerns. Doc, let's talk about now the body of a woman. When we talk about preparation for conception, there are things to do with detoxing, you know. So what can you say detoxing is really? Well,
medical professionals will never advocate for detoxing. Just go on a healthy diet. Healthy diet.
Right.
Because detoxing, what happens is you go detoxing the programs that I've seen several are you go on a calorie deficit diet. So basically you're being told, you know, juice vegetables, and fruits, and then drink that and they will detox your body. The problem, you're creating a calorie deficit and you're taking maybe even 500 calories in a day, when an ideal woman should be taking between 15 to 1800 calories. The problem is when your intake is the wrong type of diet. So I normally tell patients, just change your diet and go to a healthy diet.
Right.
Exercise. I tell people, don't people think, I'm pregnant and I shouldn't exercise. I tell people, exercise until the day you're in labor.
Right.
It should not stop. But for example, like gym, probably not. Maybe walking, swimming, you know, light jogging and stuff like that. Aerobics, where you don't require to jump off the ground. So lose weight. I don't advocate for detoxing, and most gynecologists in their right mind will not advocate for detoxing.
Right.
It's very harsh on your body. Very harsh. You're taking your body into a state of shock, not feeding it.
Maybe people don't understand what really detoxing is.
Detoxing is basically, they say it's, you know, you go on a raw food. There are different programs. Either you go on smoothies, which are basically raw foods.
Right.
And then you blend them, and then, you know, you eat that for a while.
So it's totally wrong.
I wouldn't advocate it because you're putting your body in shock. Just change your diet, because the problem with toxing, a lot of people detox and then go back to square one. So they say, oh, I've detoxed my body, so I can have some fries. I can have some pizza. I always tell people, even on a weight loss journey, change your diet to a diet that you know you can sustain for the rest of your life, and even in pregnancy. So even in pregnancy, you know, you see people gaining so much weight, and we tell them, if you gain too much weight, that weight actually remains with you. The baby will be born 3 kilos, 3.5. You know, and the person wonders, I was eating, where's the rest of the baby? So it is, change your diet to a lifestyle. It becomes not just during pregnancy or before pregnancy, till, you know, the Lord calls you home. But not, detoxing is something people do, and I've seen many just going back to the old eating habits.
Right.
So like I tell people, change the size of your plate. Change the times that you're eating. Change the type of carbohydrates you're eating. So for me, I say the rule is half your plate should be vegetables. Half, and then know how to cook your vegetables, that you don't overcook them and you lose all your nutrients. If it is carbohydrates, change to whole grain carbohydrates and eat, you know, protein. They don't have to be lean proteins, really. I usually say, you know, if you're going to buy minced meat, which is lean, it's 1,000 shillings a kilo. Just buy the normal meat, but your portion, you're making sure your portions are controlled. Cut back on sugar. If you can stop sugar, all the better.
Doc, that leads us to the next question.
Yes.
In preparation, there was some I was reading, in preparation for conception, you have to ensure that your body is well nourished, right? What sorts of food would help the body of a woman to be really nourished, and you could say that, I think I'm ready for conception?
Those who, for most women, actually, just a normal diet, they don't struggle with conception. Actually, I say most of them, they tell you, oh God, you know, Doc, I'm pregnant, I didn't even plan it. I tell them, well, you probably eat very well, you know? And then there is another group of those who struggle to conceive. and probably have to be put on a special diet. But if you go on the internet, there are women who come and tell me, I've read about, eating this, eating this, eating this. And most of them, there's nothing mentioned about detox. It's just changing diet. If you look at the Brazilians, I think there's or like the Nigerians. Nigerians in Africa have the highest fertility rate. And twins, for those who want to ask about twins, we'll ask Nigerians.
Yes.
And apparently, their diet has been attributed to the very high fertility rate. And apparently it's yams. Yams. I mean, they taste horrible, but they have been shown to, probably it's part of their diet, because they say, I think 1 in every 3 or 5 Nigerian women will have twins or triplets without hawakujaribu.
Right.
They didn't take anything to try. It's just in them. If you go to Brazil, there's a family of the yam root called maca root. So even now, if you go to some of these healthy stores like Healthy You, you find they're selling maca root powder. And when it comes to the stores, it's over. And there are patients who have said they swear by it that it works. But the good thing about that, it is a natural product. You're not detoxing. You're just going to add it into your diet. So in certain communities that get certain diets, for us who are in cities like Nairobi, what has messed us up? Fast food. Weight gain. You gain because of fast food.
Right.
I tell women, try and have the habit of carrying food to work. Whatever you make for dinner, make in excess for you to carry the next day. What will happen, like for me, if I go home and I don't have food, what will happen? There are so many fast food joints near my place. So we tell women, change your diet into a healthy diet, lots of water, get some exercise, and your body just responds very well. Even and it helps in especially balancing hormones, because a lot of conception issues are because of imbalanced hormones. One condition, polycystic ovarian disease, your hormones are haywire. You have a higher level of male hormones, which interfere with metabolism and conception and even ovulation. So most of these women come and tell you, I don't get periods for 3 or 4 months.
Right.
You have hormonal imbalance, and you have to investigate what condition they have. Some of them just tell them, lose weight, change your diet. Boom, she gets pregnant.
Right.
Didn't even plan to get pregnant, yeah.
All right, and Doc, just staying with the diet that we're supposed to take when we're preparing or thinking about conceiving, how does it affect the child, whether good diet or bad diet, just in case you're lucky to conceive, how does it affect the life of the child?
It does. If you are eating badly, high-calorie food, fast food, soft drinks, junk, you're putting yourself at risk of excessive weight gain. When you gain weight excessively in pregnancy, you put yourself at risk of hypertension, diabetes. Those 2 conditions in pregnancy adversely affect the course of pregnancy, such that if a woman gets pregnant and she develops hypertension because she's obese, you're 130 kilos. If you develop diabetes or hypertension, I won't be surprised in pregnancy. But I know that I have to put you on medication. I have to monitor your baby. Most of the time, hypertension and diabetes can be very unpredictable. Even if you're putting the patient on medication, sometimes the body just doesn't respond, and then the baby is put in trouble. So if you do not control your weight, you don't control your diet, it adversely affects you're predisposed to getting certain conditions, which of course will affect the birth of the baby. If you get uncontrolled hypertension, uncontrolled diabetes, then in pregnancy, we are forced to even deliver you early, because at the end of the day, we have to also have to look at the mother's health. So if you get hypertension, which is uncontrolled, it will affect your kidneys, affect your liver. I don't want to lose this mother, so I have to deliver the baby. Then you get a preemie. That mother is going to be in hospital. Most private hospitals, you're looking at a cost of 1 million per month. So it does affect the growth of the baby.
Right.
It does affect the cost of the pregnancy and the baby. So we tell people, prepare yourself. If you're overweight, lose that weight. You don't have to go and be, from 130 and go to 60. No. Lose a certain amount, whereby we know if you get pregnant, I'm not going to struggle with this patient.
All right.
Yeah.
And Doc, let me just remind our viewers, we're talking about preparation for conception. I do appreciate I'm seeing so much of your text messages. The number to call in, we will have a whole session in the second part of this show to just deal with your questions, because it's very important to talk about these issues. And Doc, when you are talking about the right time for conceiving, you forgot to mention the time, because I can see someone here is saying that I'm 18, but I'm wondering, am I, you know, eligible? Is it the right time for me to get pregnant? Maybe you could just look at the age.
Yes. That's why I said when we look at health, physical, social, economic, emotional, spiritual health, she's 18.
Yes.
Is she able? She can get pregnant when she wants to.
All right.
Any woman can get pregnant when they want to. With her, I'll ask her, are you able to afford to look after a child? I worked in Narok Hospital, in Narok District County Hospital, sorry, for about 6 years. Now, in certain communities, girls, as soon as you get your period, you're considered a woman and you're married off.
Right.
So the youngest patient I ever saw and delivered was a 12-year-old girl. Did she get pregnant? Yes, she got pregnant. Was she ready? No.
No.
She was not. But the community, that's how they live. So with her, her body, a 12-year-old, her hips haven't fully developed for her to have. So most of them end up with cesarean section. She's not able to push a baby out. Her hips are not developed, her bones are not. Normally for a woman, we say your hips are fully developed, the bones that allow the baby to pass to around 25 years. So you want a woman to be fully developed also physically for her to be able to bear children. 12-year-old is a very young person, so she can get pregnant. But then so emotionally, I'm trying to wonder, 12-year-old getting pregnant, she's supposed to be in school, her body is so tiny. An 18-year-old, does she have a job? Can she look after the child? So physically, oh yes, she can get pregnant.
Yes.
But is she able to emotionally support this child, economically, socially support this child? So yes, she can get pregnant. When does she want to get pregnant? She can get any time. But when that baby comes, I tell people, kubeba mimba sio kazi, wacha mtoto akuje. That's when you know there's work. So she can get pregnant, but she needs to know she should be able. And her body can actually manage a pregnancy. She can carry. But we normally will put, we normally say at least from 18 and above, we consider them to be they're not high-risk patients. Any patient less than 18 is considered to be a high-risk patient or above 35. So 18 to 35 is considered perfect ages for women to get pregnant. Your body is developed, your breasts are developed if you have to breastfeed, you know, your hips are developed and everything, so you can have a baby. Then there's the socio-economic aspect of it that normally matters. You can even get a 25-year-old, 30-year-old who's married, and you get someone telling you, you know, I'm not ready to have a baby, you know, I'm broke or something like that.
Okay, Doc, let's receive a call. I think our viewers really want to talk about this thing, though we have a session for them. Okay, Zuhura.
Yeah.
Hello, how are you?
I'm fine.
All right, talk to us.
Okay, I'm Zura Mohammed. I'm calling from Preeclampsia County. Yeah, so me, I normally have complications while pregnancy.
All right.
Kama 2013, nakuwa tu in good health, lakini kufika 7 months, BP inapanda. So nilikwenda check up, ya naambiwa wanasikia mtoto anacheza na mambo kama hayo. Lakini kwa kufika 9 months, BP ilikuwa tayari shashoot.
All right.
Sasa ile kwenda piki sana, mtoto tayari alikuwa shakufa kwa tumbo. Sasa nikaekewa dawa, lakini ilifungua normal delivery, lakini tayari mtoto alikuwa shakufa. So kuanzia wakati huo nikaogopa sana kushika ujauzito. Alafu tena 2015 tena nika-conceive. Nikawa tu vizuri, nika-attend all clinics. Sasa kufika 7 months tena nikashoot. Sasa nilishoot nikatoa breast.
Yes.
Lakini ilikuwa bad condition, bad imefura, my ankles, my face, kila kitu ilikuwa imefura. Lakini madaktari, madaktari waliniatia na nikajifungua salama kabisa, lakini nikakuwa na 2.1 kg.
Okay.
Ya sasa mpaka saa hii nimeogopa sana, nimeogopa sana mambo ya kushika ujauzito.
Okay.
Sasa ningeomba tu ushauri.
Okay, sawa. Zuhura, tutajaribu kukusaidia sana. Asante sana. And we are sorry about that. Doc, you've heard it clearly.
I've heard about her case. Congratulations, the second baby. Sorry for the loss of the first baby. So unfortunately for Zuhura, she probably had what we call preeclampsia. Now, preeclampsia is whereby, and it only comes in pregnancy. So probably Zuhura doesn't have issues of BP when she's not pregnant. But there's a condition, I call it special because it's becoming common, called preeclampsia. So in pregnancy, from around 20 weeks and above, their blood pressure shoots up. Now, there are patients who we know that it's likely to happen.
Right.
So meaning you look and say, this patient, does she have risk factors for getting high blood pressure? So women above 35, obese women, if you already are a hypertensive patient, if you previously had hypertension in your pregnancy, there is a 50% chance it will come back.
Right.
Now, such a patient should not get pregnant without seeing a doctor first.
Okay.
Because there's research that has been done, a lot of research has been done on management of hypertension. And I've had several clients who told me in my previous pregnancy, I had hypertension, and we saw them before they got pregnant. And they're normally, the research has shown two particular, one supplement, calcium, and junior aspirin, that have been shown to almost nullify the effect of you getting high blood pressure. So Zuhura should actually, even the second pregnancy, she might not have gotten hypertension if she saw a doctor before she got pregnant.
Right.
Then she's put on this medication, and she should actually be on them as well as folic acid before conception. Before conception. And then she continues with them. If you get high blood pressure in pregnancy, the problem actually is the placenta. It's not the baby, but it will affect the baby because of the connection between the mother and the baby. So and what happens, the placenta, the vessels where blood is passing through, you get small clots, and then there's a high resistance. So if you give them aspirin, aspirin has been shown at least to thin the blood and reduce the rate of inflammation. And a lot of patients who had previously hypertension in a different pregnancy, when they come back, I can tell them, come and see us before you get pregnant. We put them on aspirin, put them on calcium, put them on folic acid about 2-3 months prior to getting pregnancy. And quite a number will not get high blood pressure in pregnancy. As in, the pregnancy is so smooth, they can't believe it. Yes. Others who need to lose weight, we tell you to lose weight. And that's why it's important, especially if you have a prior medical condition or a prior difficult pregnancy. Most patients, the mistake they make is, I lost that baby, wacha nipate ingine. But you forget, go find out what happened before. Can it be prevented? There's a possibility, not 100% guarantee, unfortunately. I can put you on aspirin and calcium and you still get high blood pressure.
Right.
But it may be easier to control that blood pressure than if you are not on anything at all. And then she must be seen by a specialist. Now, Zuhura is what I call a high-risk patient.
Right.
So Zuhura, if she's in Kirinyaga, unfortunately, most of them end up going to clinics where they are seen by nurses.
Yeah.
It is good for her. If you're having a normal and eventful pregnancy, by all means, a midwife can follow you up to delivery. When you have a high-risk patient, I recommend that you see a gynecologist.
Right.
And Kirinyaga, I'm sure they have. I think I had her say she's from Kirinyaga.
Yes.
Most counties, they do. She should. I have one who comes from... where does she come from? I think one of the counties. And I asked her, why do you come all the way to Nairobi? And she said, because there's no gynecologist. Because she has lost 3 pregnancies to high blood pressure.
All right.
So when she goes to the clinic, she's just been getting pregnant. So the next time I told her, don't get pregnant before you come and see us. We are at 8 months, and she's going to reach 9 months, and we're going to be fine.
And Anne from Limuru has the same question, but her problem is she cannot get pregnant when she goes for medication. She's told her hormones are okay, but due to high blood pressure, she cannot get pregnant. Is high blood pressure really a hindrance to getting pregnant?
No, no. She just needs to see a specialist who can help her control. Here's the thing. Depending on where she lives in Limuru, what type of medication she's seeking, I don't want to fault government hospitals, but you find a lot of them are using old school drugs. Right now, there are newer drugs that are doing a better job. So I would advise her to go and see a specialist. I think even Tigoni might have a specialist. See a physician, an internal medicine specialist, who can control her blood pressure. And here's what happens with high blood pressure, especially before pregnancies: teamwork. A gynecologist should be able to manage this patient with a physician. We need to stop being heroes.
Right.
So the patient will come to me and tell me, I have high blood pressure, but I want to get pregnant. So I'll say, let me refer you to a physician. And then I tell the physician, she has high blood pressure, she wants to get pregnant. Control the pressures for me, and in fact, preferably change to medication that I would prefer her to use in pregnancy, because some hypertensive drugs that may control your blood pressure when you're not pregnant are not supposed to be used in pregnancy.
All right, Doc. I think we're now going to take a short break. Remember, we are talking matters preparation for conception. We've already looked at some of the personal environment that can really affect someone into conceiving. But I know, Doc, there are so many questions that are coming in terms of emergency pregnancies. How do you, is there a conception calendar and all that?
Absolutely.
We are going to address those issues when we come back. Keep those questions coming. In the next session, we'll also be looking at your questions. We'll also be receiving your calls. But first, we want to take that break. Before then, or after then, we'll also be looking at some of the home remedies for conception. Stay with us. Welcome back to this second part of my Doctor Show, and the very last. Remember, it is a session that we will be looking at some of your questions, both from our SMS line, and we will also be receiving your calls. My name is Purity Musel. We want to continue with this discussion, but before then, we want to get some tips or basic information on how to prepare for conception from Dr. Sikolia Wanyonyi of Aga Khan Hospital. Take a look.
The human body develops through stages. Yeah, so you go into the reproductive phase, and that starts from the age of about 18 when you start, 14 when you start getting your periods. We call that age the menarche. And that is the onset of fertility. So that's one of the markers that shows that a woman is fertile. But that does not mean that she is ready to carry a pregnancy. She can conceive, yes, but her bones and structure and build is not yet ready for that. But from around the age of 20 onwards, a woman will be ready actually to conceive and carry a pregnancy without much complication. So the ideal age usually is around 20, 21, 22. That is when you have the least amount of risks to your pregnancy, and your health is at the optimum. Yeah, but of course there are other things to consider before that. I mean, there are people who have other pre-existing conditions. So you have diabetes, for instance, or you have the hypertension, or you're on treatment for other things. The ideal time for you would be when that condition has been controlled. So for instance, if you have diabetes, the ideal time for conception, even if you are 25, is when your sugars are well controlled. If you have a thyroid disease, is when that is controlled. Because the moment you become pregnant, then the pregnant is going to affect that condition. Either it will make it worse or increase the need for medications to control that condition. So that is not much I can say about the timing for conception. But most of the time it's an individual choice. There are so many other factors. I mean, there are people who want to finish school, they want to do what before they can conceive. So there are many other underlying factors in which at an individual level. Now, before you conceive, of course, you have to be in the, ideally should be in the best health. Unfortunately, a majority of the women realize they've conceived when they've gone out to party. And that is when they do the test somewhere and then realize, and then they return the orders that they've made. Okay, so there are things that you need to change in your life. So for instance, if you drink, you should stop or minimize the amount of alcohol that you take. If you smoke, you should quit actually completely. You should not smoke at all. If you are abusing stuff or using other substance, recreational drugs, then you should stop. And then there are drugs that you may be on because of your health that could affect the pregnancy. For instance, someone who has epilepsy and they're on drugs that have controlled the epilepsy, but those drugs are very toxic to the baby. So I would advise that they see their physician so that they put them on the minimum dose or on the safest drug. Then the occupations. You realize that when you come to see us, we ask you, what do you do? Your occupation is very important because there are some occupational exposures. So if you are a farmer, a flower farmer who is spraying the farms all the time, you are exposed to the pesticides. Those chemicals can actually harm your pregnancy. If you are working in, let's say, a radiology department, you are exposed to x-rays. We may say that you modify, you get other things to do in your department that will put you at less risk. So those are the things that you can modify. To help with the development of the baby, it's recommended worldwide that a woman should be commenced on folic acid. It's a small little vitamin drug that does wonders. It actually prevents most of the formation of abnormalities of the brain and the spine, which is very prevalent in our region. Alternatively, if you're not a fan of taking the medicine, then you can be choosy during your shopping. So when you're buying cereals, when you're buying flour in the supermarket, you buy those that are fortified with folic acid, and those will improve, will help with the formation or development of the baby.
And you've heard it from the only fetal maternal expert we have here in the country. For those who are asking about age, at least 20. And Doc, there's something that Dr. Sikolia has brought out, the issue of preparing or planning for your pregnancy. Many people just realize when it's already done that, you know what, I'm pregnant. Is it possible to, you know, plan that this is the day that I want to get pregnant, or this is the month, or this is the year that I want to get pregnant, without having so many accidents, you know? Can we call them accidents or emergencies or something, pregnancies?
Yeah, they are, I mean, they are accidents, but I say they're not accidents to God, but they are, you know, most women you meet who get a pregnancy they haven't planned for, even those who are married, I get surprised because they are devastated. I see a woman telling me, I can't believe I'm pregnant. And the first thing in my head, I'm like, but you're married, so it's okay. But they tell you they hadn't planned. And that's why the emotional aspect of you being prepared for pregnancy is so important. Just as Dr. Sikolia said, is you can having your period at 14 years old, you can get pregnant, but are you ready? Maybe you're 20, you can get pregnant. It's the optimum age for getting pregnant, as he has said. But are you ready? Maybe you're thinking, I need to finish school, I need to get a job, you know, stuff like that. So in terms of getting ready for pregnancy, with many patients getting accidents, yes, you can. One way is if you're not planning to get pregnant, but you are sexually active, contraception.
Right.
Contraception. And there are those that you can use that you know, if I stop this month, the next month I'm going to get pregnant. If you use like pills or use the coil, the pill, the good thing is one pill every day, 24, you know, it works for 24 hours. So if you stop, the next month should be easy for you to get pregnant, especially the combined oral contraceptive. The coil is non-hormonal, so it's a copper T that's put inside the uterus. If you remove it the next month, the other methods like the implants, they may maybe at most 6 months, but even others are able to conceive the next month. So planning ahead is saying, I want to get, right now I want to get pregnant in December. So I need to use something up to November. Then, as he has said, start folic acid. He has said it does wonders. It's a wonder drug. It prevents abnormalities, especially in women who are high risk, you know, above 35, you have a high risk, possibility of having a high risk pregnancy if you are diabetic or hypertensive or have thyroid disease. Start folic acid before you conceive, and you can plan. Now, if you want to plan when to conceive, that totally depends on your cycle. That depends on your cycle.
All right, and Doc, before we get to look at some of the questions, do we have a conception calendar? You know, so many people are excited. They want to know, how do you plan for this? Do you have a calendar? How do you monitor your cycle?
Absolutely. I wish we had one, then I could really show you better. Now, a woman's cycle, most cycles, when you ask a woman, how long is your cycle? They tell you 5 days. We're like, no. Your cycle starts from the day you get your period. Right. Now, I'm going to talk about women who have normal, regular periods, not the ones who have abnormal irregular. Or because of hormonal imbalance. So most women, normal cycles are between 21 and 35 days. So the one who has 21-day cycle, if she gets her period on the, let's say, 1st of April, the next one will come on 22nd. But if she doesn't know, she'll come and say, you know, I got my period twice this month. Because her friends are getting theirs once a month. But her cycle is different from theirs, as long as it's within 21 and 35 days. And these days with phones, I tell patients, there's an app called Period Tracker. There are so many apps now. The one I see most is Period Tracker. When your period comes, tap on that car. Or I think it's a picture of a cat. And then it locks in. It doesn't matter the number of days you bleed. Of course, if it's more than 7 days, we consider that abnormal. 2 to 7 days is the days you should bleed. Now, when your cycle starts, if you have a 21-day cycle, somewhere in the middle of that cycle, you're going to ovulate. The date, what people need to remember, is the date of ovulation to the next period. In all women, standard is 14 days.
All right.
The one that keeps changing is from when you get your period to when you ovulate. That one changes. If you have a 21-day cycle, it will be 7 days. If you have a 28-day cycle, it will be 14 days. If you have a 35-day cycle, it will be 21 days. If you have a 26-day cycle, it will be 12 days. But the day you ovulate to the next period, 14 days.
Right.
So if you have a period tracker and then you track your period for 3 months, then you'll be able to tell, oh, my period, I can see my cycle is 24, maybe it can come 25, 26 days. Or there are people who have clockwork cycles.
Right.
They tell you 28 days is coming. So if you say, okay, my period came on the 1st of April, and I have a 28-day cycle,
29.
then I say a 21-day cycle. Then I say I plan to conceive. So when can she try? Ovulation is to next cycle is 14 days. So she just needs to remember day 8. That's when she's going to ovulate.
Day 8?
Day 8.
Please make me understand.
Okay. That's, I'm saying I wish we had a calendar, then we'd really display it. We can do that next time. We can have a big calendar or a board, then we draw. I normally draw for and write dates, and then I circle the days that they should try. So if I have a 21-day cycle, meaning every...
You get your periods after every 21 days. All right.
The day your period starts, that's the day of the beginning of the cycle. That is day 1. If my period comes on the 5th of April, that is day 1. Forget about the date, the day your period, the date comes, that's number 1, day 1. So if I have a 21-day cycle, so I said, imekuja 5th, count 21 days. Now it will tell me when it will come. So 22nd day is the date will come. The next one will come. Then count 14 days backwards because ovulation to the next period.
If it's 5th, it will come on the 26th.
It will come on the, no. Yes, yes, it will come 27th.
Yes.
See 5, then plus 21 days, 26, then maybe 27th will start. Then you say, if it's going to come on 27th, count 14 days backwards. Exactly 14 days. That's when you ovulated.
Okay.
So that's when you try for your baby. Now, when men deposit semen in a woman's vaginal canal, that semen is actually viable for 72 hours. So you can even say, if I'm ovulating on the 8th, let's say now, okay, let's take 5th. So she's going to ovulate maybe on, if you add 5 plus 7, that comes to 12, maybe she'll ovulate somewhere, maybe 12th or 13th. So if semen can remain in a woman's vaginal canal for 72 hours, it's viable, then this 8 take 3 days ahead. But when the ovum comes up, the egg comes out, it's only good for about 24 to 48 hours. It's unfair like that.
Yeah.
The egg comes out and just hangs one day. If it doesn't, it's not fertilized, disappears.
Right.
So I tell patients, normally add the date you're suspecting you're ovulating, add 3 days to those days and 2 days. So you actually have about 6 days to work with. And then those days have intercourse as much as you can. Yeah.
Okay.
If you have a 14-day cycle, then I get my period on the 1st of April, on the 1st of April, then I'll ovulate around the 14th, then the period will come around the 29th. Then I tell her, circle 14th, add 3 days, so 13, 12, 11. Then she will take 15, 16th, those are the... So if you're not planning to get pregnant like the Catholics who don't use contraception, they call those the unsafe days. Meaning because if you do them and they don't use contraception, those are the unsafe days. For those who are trying, those are the days to try. Yeah.
And Doc, maybe we can take a few questions.
Absolutely.
Hey, my name is Jen from Ebru County. I lost my pregnancy at 7 months, 2 weeks due to BP. That was the report from the doctor. That was the 1st of February this year, actually.
Wow.
It was my first child, and I'm really afraid, Is there any charges for me conceiving? I think it's chances for me to conceive again, and how long should I wait to conceive?
Absolutely, she can. She shouldn't lose hope. And as Dr. Sikoli has said, and as Ali had said, if you had a prior medical condition in pregnancy, I would tell her maybe give her body 6 months to recover. Most of them make the mistake of getting pregnant immediately. Like, I need to replace this baby. Give yourself time to mourn, time to grieve, and time for your body to heal. Because BP was affecting her body. It will come back again. Now, we are saying let her, now we can give her about 6 months. So from February, add 6 months, that comes to August. August, for now, she needs to be on contraception, first of all, so that she doesn't get pregnant as soon as possible. So be on contraception, and for her, the ideal one would be the coil. Because if she had high blood pressure, we don't recommend that she uses the hormonal methods. So she goes to hospital, gets a coil inserted until August. Before that coil is removed, see a gynecologist who will put her on aspirin, calcium, and folic acid. He has told us folic acid is a wonder drug. Aspirin, she can start either as early as from even before conception, but a lot of studies now are saying they should start from 5 weeks of conception, and then remove the coil and then get pregnant. Don't get pregnant without seeing a doctor, and don't get pregnant before 6 months have lapsed for her body to recover. But do not